j'ai un enfant qui était malade. Donc je l'ai envoyé au dispensaire. Bon, on a parlé de l'anémie, manque de sang. Donc, qu'est-ce qu'il fallait faire? Maintenant, quand j'ai envoyé l'enfant à la maison, bon, on me dit de l'envoyer à Banfora. Bon, je suis arrivé dans la nuit. À 5 h du matin, l'enfant a rendu l'âme. Voilà.
The death of this father's child was caused by malaria. More than 1 million people, mostly young children, die from malaria each year in Africa. Today, Inuso Sawadogo is a volunteer in a research program offering a fresh approach to treating malaria and pneumonia. Inusa Sawadogo lives in the Banfor region of Burkina Faso in West Africa. Most people here are small-scale farmers, growing crops like mangoes and raising livestock. They live in isolated villages without any medical facilities. To reach a health center, residents travel great distances, often by foot.
So we thought that in that situation it would be nice maybe to try to educate people on how to take drugs. And we knew that in several communities we have a kind of leaders who are well listened by the population.
In the community management program, volunteers, known as community health workers, are trained to diagnose disease and administer drugs. The community health workers maintain a supply of drugs and sell them at a low cost. TDR studies show that by improving access to malaria treatments, the number of deaths can be effectively reduced.
We have seen that in terms of malaria, people were really complying with that strategy. Now we know that in our setting here, you have the two killers are malaria and pneumonia. And we just say why we shouldn't combine this strategy targeting these two main killers.
The new malaria and pneumonia study examines if community health workers can effectively handle more than one disease at a time. There are 3 study arms. In one, community health workers treat children for malaria only. In another, they treat both malaria and pneumonia. And in the control arm, there is no intervention. 119 villages with a population of 75,000 are participating in this study. This community health worker, Fatoumata Yampa, has been trained to identify the symptoms of malaria. 70% of the adult population is illiterate, so graphic posters and clearly illustrated packaging help explain how the drugs need to be given. Yampa makes sure that parents understand how the medicine must be given.
Don ni sera furanta chukura ibna lon furani furanya namalo me ni ma takanye bon ibna na foko fura mi suma fura mi be yanfe kwantara mane ko ayi ko ati kasoro atachukolo wala malo ni afamu
This community health worker, Inosan Sawadogo, has been trained to diagnose both malaria and pneumonia. He confirms cases of pneumonia by using this simple tool, a clock. He counts the breaths of the child per minute to see if the rate is faster than normal.
Monaya e atamashin butara sumaya fana. Alors ambe sumaya fladam. Voilà.
The study is implemented in stages so that all villages in the region gradually join the study. Villages like this one serve as a control group until they join the program. Until then, the medical difficulties they face continue.
Me ni edim banana sigen barawa ume sigen tara kata plaketu sigen bara sigen yemuye asigen era kacha ni bana digira dena ni tara doto sura wari bokacha mena adam na doni ni kona katani awari boti cha do o fara fin plan yemule fara fin plan obisega flag male dideni ma abisega ka yiri mugo ba yiri bo ka ka fla mugo do bisega jene ka ka finanye fana ka dideni.
This health center was the only health service available to 39,000 people before community management was introduced. The head of the center, Nabila Batiano, is a nurse who received a prize for his work in the community management program.
Dans la communauté, la motivation est très importante. L'encouragement est important. Ça amène à aller au-delà des attentes.
The malaria and pneumonia study is being directed by Dr. Sodiomen Sirima. He himself comes from the Banfor region, and his own family has experienced the devastation that malaria can cause.
I have several brothers and sisters who had malaria, and I'm quite sure I lost 2 of my brothers who died after. His death was consecutive to convulsions.
Dr. Sirima is one of the pioneers of the community management system. He has worked with TDR on 6 different studies and expanded local research expertise.
Considering myself as quite a scientist made by TDR, when I was started in my institute, I was the unique physician. Now I should say that there are 11 physicians. Now we are 40 scientists, with 15 having a PhD.
Dr. Sirima estimates that scaling up the malaria and pneumonia model to a wider population would cost $7 per child per year.
So if you have if you just take 1,000, you need $7,000 for a year to provide just training to community health workers who are supposed to take care of their kids, to also provide them drugs and pay supervision to his population.
The results of the current study will be known in 2013, when the mortality rates of children under the age of 5 are analyzed. In the meantime, safety monitoring indicates drugs are being properly used.
We haven't seen any difference in terms of misuse of the drug if you compare malaria versus malaria plus pneumonia.
There are other signs that the study is on the right path.
Bon, faut dire que c'est vrai que vous intervenez dans une partie du district, mais nous on a constaté aussi que il y a quand même une réduction globale des cas de paludisme grave dans nos chiffres qu'on a tenté d'expliquer plus ou moins par déjà les interventions et toutes les interventions qui ont lieu chez nous.
En écoutant la communauté, je peux dire que l'impact est positif, en ce sens que les témoignages disent que depuis que l'intervention a été mise en place, ils ont moins de malades et ils ont enregistré aussi moins de décès d'enfants. Voilà, donc l'intervention en valait la peine.
For the people living in these villages, the value of the community case management program is quite clear.
Tout le monde est d'accord avec l'intervention parce que ça posait des actes concrets, positifs, ça sauvait des vies.
Mais ala ne alu sababura ne fana kera banabato dem bagadoy donc ne be ala tando ka alu fo ka wali mando.
Je me dis que si avec Quartem, l'enfant, on pouvait quand même le sauver. Voilà, on pouvait quand même le sauver. Donc, je peux dire que l'enfant, il n'allait même pas mourir.